Well, thank you so much, Janet, and thank you, MOLA, for hosting us. I know Tiffany and I are both extremely excited to dive into everything that we have to share. It's going to be really high impact, helpful, actionable advice regarding the application documents and strategy. So again, my name is Zeph Vessel. I have been in the residency application field in various forms since 2009. And as Janet said, I have served as the Chief Residency Advisor for Match a Resident, and I was the Editor-in-Chief for Residency Statements and Residency Experts. It was actually when I was working with Residency Statements that Tiffany and I met. And since then, we have started Class Act ERAS Consulting as a way to work more directly with applicants, more one-on-one, offering the full scope of guidance, support, and assistance that we feel everybody can benefit from. So again, we're really excited today, and I'm going to pass it over to Tiffany, who's going to start us off.
Thank you, Zeph. So thank you for having me. And Janet, you gave a really great introduction. I'll just reiterate that I've been doing this for many years. This is my 11th match cycle working with residency applicants. And my background is in writing and teaching, and that all came together really well through working with Residency Statement and Match a Resident, where I was the Director of Communications. So that's my brief introduction, and I'm going to share my screen and jump right into the presentation. If you guys have questions about anything that we're talking about, that I'm talking about, and I'm going to cover the ERAS CV and the personal statement, go ahead and drop those in the chat. Zeph's going to monitor those, and we'll try to answer them at the relevant points of the presentation. Okay. Okay, my screen looks good?
It does, thank you.
Okay, perfect. I'm just gonna move the window out of the way here. Okay. All right, so our presentation today is called Strategies for an Exceptional ERAS Application, and that's exactly what we're going to talk about. As Zeph said, really actionable, concrete ideas are coming right up here. So we're going to talk about the MyERAS application, which we also often call the ERAS CV, the personal statement. Then Zeph is going to jump into some program research and some signaling strategy, and then we'll talk about supplemental documents as well. Oops, went a little too fast. So for anyone who's just starting this process, you probably already know that the application is kind of complex. There's a lot of moving pieces. The main components here are the MyERAS application, personal statement or statements, and I'll cover those. Zeph's going to talk about the ERAS photo, MSPE, your medical school transcript, letters of recommendation, and then other outside components are the USMLE transcript and the ECFMG status report, which the ECFMG status report is a question that we get asked about a lot. That's something that ECFMG uploads on your behalf. So there's no actionable item for you to do there. They're simply going to include your status within ERAS for programs to be able to review. Okay, so starting in with the CV. I like to make sure that when you are looking at your application, you are doing so from within the right perspective. Sometimes people want the CV or the personal statement to do everything. And the way that the application really works is that every piece does its own thing rather than every piece doing everything. So we separate the PS and the CV into two very distinct types of application components. The CV is purely objective. It's fact-based, and it's a technical writing style. So outside of the meaningful experiences, which we'll talk about, there should not be any flowery language or any reflective thoughts on what you did during your experiences. So we're keeping it objective and fact-based with a technical writing component. The personal statement, on the other hand, is subjective. So this is more so about how you feel, what your thoughts on your specialty are, and it can be more of a narrative approach. So very different documents with different content and approached from a writing perspective very, very differently. So we'll start with the ERAS experiences. And when you write these, they should be powerful, impactful, and concise. And that's what I'm going to share with you how to do in the following slides. So let's take a look at the box on the left. And this format that you're seeing in front of you is what programs will see if they look at the if they look at the ERAS crafted version. of your application. There will be 10 boxes that look exactly as these look, just stacked in a row, 1 through 10. So we've mirrored that here. And what I really want to emphasize in this first screen is the difference between the one on the left, which is too dense, and the one on the right, which is much better. Not best, we'll get to best, but better. And the reason why is because the one on the left is very difficult to skim. It's really dense, it's a thick paragraph. It's hard to look at it and kind of take a glance and see what that activity or that experience was actually about. If we shift over to the one on the right, where we're using bullet points and getting rid of the first person language, it's a lot easier for the eyes, for the program director's eyes specifically, to read through that at a glance and understand, oh, okay, this person, they took histories, they worked with Epic. I can see that they observed cases of different types of illnesses. So it's much easier to assess when we start to break things down in a more simple and easier to read format. So let's look at best, which is the one here on the right. So the better, which is on the left here, that's pretty good because we've got some white space. We're using bullets. We've gotten rid of first person. The one on the right, however, we've really
Who wants to participate?
We've really maximized the white space, and we're using sub bullets as well to further delineate what the details of the experiences are. So in the example on the right, it is extremely easy for a program director to look at that box for maybe 2 to 3 seconds and skim through it and know exactly, with a pretty good idea, what this person did within the experience. They don't have to work hard. They don't have to read very closely and stop and take their time. They can just skim. And guys, this is really important. When I'm talking about skimming, the reason that I'm suggesting that program directors need to be able to skim is because there's a lot of research that shows just general readers, whenever you encounter a document for the first time, you do skim it to get an idea of what it's all about, what you're looking at, and where you want to go first. So that's why we strongly recommend this approach, is because it's highly likely that the program director is going to skim through all 10 of these boxes to get a feel for who you are and what your experiences are. And I'm going to reverse back to this one. If you take a look at this one on the left, it's extremely difficult to make a quick assessment of what the experience is about. So essentially, visual presentation really, really matters. And you want your visual presentation to be as roomy as possible, meaning that there's a lot of white space and you're using shorter sentences. Okay, so now I'm going to break down this box kind of piece by piece because, as everybody knows, every little component matters. Down the road, if you are selected for an interview, it is very likely that your CV is going to be read very, very slowly, very carefully. So when we get to that level, we want everything to be perfect. So starting up at the top with the title or position, and that's this dark gray box underneath experience number 1. I see a lot of people on their CVs writing things just like, clinical rotation or medical student, something very simple and not descriptive. What you want to do is to have a title or position that is extremely descriptive and puts a really good label on what the box is going to be about. So in this case, it's anesthesiology. We know the specialty right away. Clinical rotation. Now we know what the experience was. And then inpatient and outpatient. So the setting is even included right there at the top. It removes any questions about the setting, about what the specialty is, or about what the experience actually was right at the forefront. Then we have all the different drop downs, which are going to be your primary focus, your experience type, and your key characteristics. So these have several different options that you can choose from. Within each one of the drop downs, there's anywhere from 6 to 10 different options. And AAMC does have very, very concise descriptions or definitions of what each of the options are. When you're going through and you're selecting from the drop downs, it can sometimes be confusing. To be honest, there's not a category that fits every experience really, really perfectly. But for most of them, there's something close enough. And so you want to pick the one that most accurately reflects what the experience type or characteristic or focus was. The other boxes in this section are essentially just identifying information, talking about the organization, the location, again, the setting in a different context. So the urban versus rural setting, and then your dates of the experience and your participation as well. The supporting details, this is the meat of the CV, and this is the hardest part. So this is the context, roles, and responsibilities section. I'm going to actually go through it in a little bit of detail with you guys. So in this particular example, the preceptor's name is included, and that's not required. In previous versions of the ERAS CV, several years ago, there was actually a separate box to put the preceptor, and they've since removed that. So if there is room within the box, and if you feel that the person's name might help you in some way, perhaps they're a well-known physician in the field, perhaps you're applying to that particular hospital where you did the rotation and you just want to call attention to the person that was your preceptor, there's a lot of good reasons to include that name. So if you're going to do that, it belongs right up at the top. We just kind of get that out of the way before you go into what your experiences actually are. So in this case, let's look at the bullets. So the first one, took histories and performed physical exams on new and established patients with comorbidities. This is a bullet that is present in a lot of people's experience boxes, because when you do clinical rotations or outpatient experiences, pretty much that's one of the big components of what you're learning to do, is taking the history and performing the physical exams. I encourage you guys not to try to make this sound any different than what it is. It's best to be straight. I think I got muted for a second, but I think I'm back. Okay. It's best to be straightforward. It's best to be really clear and direct, even if you think that what you are writing is, cliche or cookie cutter in some way. There are going to be some bullet points that just are what they are, and it's okay to be straightforward with those. So same thing with presented cases to attendings. Now, a way that could be strengthened would be to maybe add a detail or two about what cases were presented, if there was anything particularly interesting. Assisted in blood transfusions, vaccinations, and biopsies. So we put those at an indent, so they're sub bullets, because that makes it easier for the eye to see them. And including these details of the different types of hands-on experiences that you had is really important within the experience box. Suggested differential diagnoses and courses of treatment. Again, a way to strengthen that could be to add what some of those diagnoses were, if there were anything that was particularly interesting. It's not necessary to literally list out every single case that you encountered, especially if they're, kind of common conditions. But if you did encounter something really neat, then you would want to include it. Gained experience with Epic EMR. So I do see a lot of people including a bullet point about working with the EMR, but very often they forget to include which EMR. And that is really important, because hospitals and programs, they like to know if you have experience with their particular EMR. So it's just a tiny little detail that is really important and can actually earn you some points. Programs do tend to like when you are already familiar with the system that they're using. Observed cases of hemophilia and sickle cell anemia. So this is just a little bit more detail about what types of conditions the person encountered during their rotation, and then presented on palliative care, hospice care, and sickle cell anemia. So reinforcing kind of the diversity of the experience with a couple of details on what they did extra research on. And altogether, this paints a picture of what this person did during the experience in a really concise, direct, and objective way, which is exactly what you want to do. Okay. Lost a couple of. So we talked about the bullet points. Let's talk about character count. This year, there are 750 characters allowed within this particular section of your experience. And in previous years, it was 1,020. So they have taken a number of characters away. We did attend an AAMC presentation a month or so back, and we asked, why did they do this? And they said, because they want quality over quantity. So they're sending the message that they want what's in this box to be detailed and relevant and direct. They are not looking for reflections. You'll notice in this box that there's nothing about, you know, how the person felt about the experience or any soft skills about like communication and things of that nature. It's just direct and straightforward, much like a resume would be. Okay, this is a different experience box because there's two more components that I want to talk about. The previous one, if you recall, was a clinical rotation for anesthesiology. In this one, we have an international on-ship volunteer, and this is for an organization called Mercy Ships. And the reason that I'm calling attention to it is because of the context and the meaningful experience section. So the context up at the top of this box is explaining what Mercy Ships is. We wouldn't need to do that in a clinical rotation experience because it's obvious what it is. There could be an exception to that where if it's a little known hospital or perhaps it's a hospital that has a really unique patient population, anytime there's like a detail about the organization or about the experience that's not a bullet point that you did, that would be an indicator that you could include some context within the box. You do have to be really mindful when you're including context because of your space constraints. So we don't necessarily want to use up half of our space by giving an explanation of what the organization is. But if it's needed to understand what you did, then you do want to go ahead and include it. And it worked well in this particular case because the bullets were pretty simple. There's just 4 of them, so it was really straightforward. The other component here is meaningful experiences. So the meaningful experience, you're allowed to choose 3 of them, and basically you'll tag those 3 experiences as your most meaningful out of the 10. And when you do that, ERAS organizes your experiences by those meaningful experiences being placed at the top. They're chronologically meaningful experience 1, 2, and 3. And then starting with number 4, the rest of your experiences start over chronologically from there. So your selection of meaningful experiences is incredibly important because it's the first handful of experiences that the program is going to see when they open up your application. You do want to choose, you want to be genuine and you want to choose meaningful experiences that truly were meaningful to you, but you also want to be strategic since you have a little bit of control over that first content being presented. So do think really hard about which experiences you're choosing. Think about your specialty, think about the type of programs that you're applying to, and think what experiences you want that particular subset of programs to see first. And that can also inform what you write in your meaningful experiences. So meaningful experiences are completely distinct from the bullet points above them. The bullet points are objective, fact-based, straightforward. Meaningful experiences are the opposite. They are this very specific AAMC instructions are not to talk about what you did and not to talk about what you learned. And that tends to be the type of entry I see. I would say 75 or more % of the time, because that's kind of just what comes naturally, I think, when you're trying to draft something for the meaningful experience entry. But what you want to do instead is think about your feelings, think about what the experience actually meant to you, perhaps how it changed your perspective, either on medicine as a whole, your perspective of a certain area of the world, your perspective of certain population of people. So in this example, it reads, many of the patients I met were living in horrible conditions, yet they aimed to spread joy however they could. The hands-on experience went beyond clinical training. I learned the true meaning of gratitude, compassion, and humility. So you can see it just captures the feeling. It captures what the personal takeaway beyond the learning experience, what that was for the person. And you have 300 characters for your meaningful experiences, which is about 3 sentences. It's not a lot of space. And frankly, it can be really challenging to say something meaningful within 300 characters, but it is possible. I always recommend starting with a bigger draft, kind of pour your heart out, write as much as you can about why the experience was meaningful, and then go back through and start parsing it down, start trimming, start locating the really strong ideas, and then put them together in 2 to 3 sentences. So again, you'll get to choose, excuse me, you'll get to choose 3 of these, and they will be the first 3 experiences presented within ERAS. Okay. So now we're going to talk about the ERAS supplemental sections. We have the 10 experience boxes, which, as I said, that's the meat of your application. They are really important. But these other sections are also really important, and they involve more writing. So that's the geographic preferences, your setting preference, impactful experience, hobbies, awards, and then extensions or interruptions. So let's take a look at those 2. People often ask, do I need to choose a geographic preference? Is it important? Can I just put no preference? And the answer is resoundingly yes. You should choose 3 geographic preferences because you are allowed to. And the research just from the last season shows, as it's quoted right here, that there is an increase in the odds of an application receiving an interview, even in the setting of a preference signal. And Zeph's going to talk about signals. But the important part here is that you increase your chances of getting interviews within the programs that fall into the geographic preference regions that you pick. So you have to pick these again strategically. I suppose a combination of where you actually want to be. If you have family in a certain area or you have lived somewhere and you just love it there, but the strategy component is important too. So as you go through your program research and you start to see which regions your programs fall into, you really want to look hard and find the 3 regions where your programs are the densest so that you're maximizing the power of your geographic preferences and getting interviews. These are 300 characters each. So you select your region, and then you also have the opportunity to write about why you selected that region. I discussed a couple of the reasons, which could be that you have family living in the area, could be that you have spent time traveling in the area, that you completed rotations in the area, you live in the area. If you don't have something that's a real personal connection, it is okay to simply talk about liking the climate, liking the landscape, liking the type of culture and community that you have researched about that particular region. So it is okay if you don't have a tie to the area. Ties to the area can be a stronger reason when programs are reading your explanation, but it's okay if you don't. When it comes to setting preferences, you can only choose one, and your options are suburban, urban, rural, some combination of those, or no preference. For the vast majority, well, maybe not the vast majority, but I would say for many applicants, choosing no preference for the setting is the smartest choice. And the reason for that is if you choose, let's just say urban, rural programs are not going to have as much interest in your application because there is a very vast difference between an urban setting and a rural setting. And if you prefer one over the other, the program, they just are going to have a preference for people who prefer the type of setting that they are in. So rather than risk alienating any type of program in any type of setting, it usually makes the most sense just to choose no preference in this section. If you have a really strong application and you feel very strongly about your setting, then it is definitely at your discretion to choose one of the options instead of no preference. You also, if you are location bound and you cannot leave the state that you're in for whatever reason, and you kind of have to put all of your eggs in one basket, then you would want to choose the setting preference that aligns with where you have to stay. Same for the geographic preference. If you're location bound, you're only going to choose one. I have worked with people who literally cannot move out of the state that they live in for various reasons. And in that case, you just put all of your effort into one place. Okay, the impactful experience. And it's not a very well named section of the application because it's not about anything that was impactful to you along your journey to residency. It is specifically asking for applicants to talk about any hardships or obstacles that they encountered on this path. So I'm including these just because a lot of applicants like to well, a better way to say it is that there's kind of a pervasive idea that you need to complete every section, no matter what. Like you have to write something. Don't leave the section blank. You have to put something. That is not the case for the impactful experience. It is certainly open and available for anybody who wants to include it, but please pay attention to what the AAMC is telling us. And this is all directly from the application. So please consider whether the section applies to you. Programs do not expect all applicants to complete the section. It is intended specifically for applicants who have overcome major challenges and obstacles. And they acknowledge some applicants may not have experiences that are relevant to the section. Not everyone has been through a significant hardship or had to overcome a major obstacle to get to residency. And they also acknowledge that people who have had these experiences may not feel comfortable sharing that level of personal information within the application. So 100% okay to leave this section blank if you don't have something that's very relevant to share. And so let's look at some examples, excuse me, of what one might share. And again, this is all coming directly from the application. So family background. For instance, if you're the first generation to graduate from college, having grown up in a low income family, having grown up in an area where there's food scarcity, a high crime rate, or lack of access to medical care, having very limited access to education and mentors along the way, having to kind of do it all yourself and figure things out on your own, and other general life circumstances like loss of a family member or severe illness. So this is not an exhaustive list. It's just a very brief list of examples that they share. And you can take advantage of using this section if you have actually experienced a really difficult hardship or obstacle. In this section, you have 750 characters, so a little bit more space than you had like for the meaningful experience. And it's enough space to tell a little bit of a story. Unlike the other components of the application, of the CV component, this is narrative, it's first person. As I said, you can tell a story. So you want to use that space to your advantage. You do want to have a positive tone, which contradicts a little bit with the point of the section, which is for hardships. But you definitely want to, by the end of your 750 characters, you want to have turned things around into either this is what I learned or this is where I'm at now, so that it's ending on a positive note. We don't want to ever leave someone with the woe is me or feel bad for me type of feeling. More like, wow, this person is a warrior. They have gone through something really impactful and they've come out the other side as a really positive person. So that's the idea that you should try to execute if you choose to complete this part. Okay, a couple more small sections. Hobbies. And hobbies is something that they have changed up again this year. Last year, it was something that could be included within the experience box itself. This year, they've taken it out and given it its own section, which is awesome. But what's not awesome is that they only allow 300 characters. So it's very difficult to write meaningfully and include detail within 300 characters. There's two good approaches to doing this. If you have a long list of really unique hobbies, like you go scuba diving, you jump out of airplanes, you ride a unicycle, you maybe have a snake farm in your family, something that is a list of things that are really unique and they stand out, you might use those 300 characters to list them. If you don't have a whole good list of really unique hobbies, you just have one or two things that are somewhat unique, you're pretty interested in them, and you have a history in participating in that hobby, then you could just include one or two and give a sentence or two of detail about that hobby, just so they get some more insight into exactly how you do the hobby, or exactly sometimes you might be making something, you might be contributing to something, and you can give that detail the best you can within the 300 characters. Try to avoid cliches. Traveling, cooking, reading, those are the top three that come to mind as far as like these are everybody's hobbies. It seems like if you can skip those and find something much more unique and personal to you, that would be advisable. Extensions and interruptions. This is another area. This was a big change to the ERAS application this year, actually. So in previous years, this was commonly called like the gap section. So if you had a gap in your medical education for any reason, because you took a research year, because you took dedicated USMLE study time, because you came to the US to rotate for 6 months, that used to be all included within the gap section. Now they've retitled it and they've given new directions. So it's called extensions and interruptions, and they are only wanting you to select yes if you have had a professional or academic issue, which basically means a disciplinary issue, or you failed a class or more and that prolonged your medical education. So again, disciplinary issues, either professional or academic related, would be the only reason that you would select yes in this section. If you took time, dedicated study time, you're going to select no. If you came over to the US and you delayed by a semester, you're going to select no. If you had COVID and you were sick and you had to take a semester off, you're going to select no. So it's professional academic only. If you do select yes, you get 510 characters to explain what that issue was about. And awards. So awards used to be a open text box where you could type in the different types of awards. Now they have formalized it a little bit more, and you will have to include these 4 specific pieces of information. So the honor or award type, and I left the drop down box so you guys could see what the different options are. The last option is like other. So really it could be anything that you might deem an honor or an award. And then the formal name of it, the award, a brief description, you get 100 characters. So it's just, maintained above 3.75 GPA, something of that nature, just very direct, very straightforward. And then the date that the award was received on.
Awesome.
Okay.
Tiffany, before we head on to the personal statement, you cool to answer a couple questions about the ERAS application?
Yes, absolutely. I was gonna pause right now. So perfect.
Awesome. Yeah, well, thank you so much, first off, for sharing that in-depth and concise explanation for all those sections. We do have a couple questions that I think are very relevant. So the first one is, if we have no geographical preference, how should we effectively describe this decision? So I don't know if you want to maybe re-explain the difference between geographical preferences and the setting preference, and then yeah, maybe address if they have no geographical preference versus no setting preference.
Yeah. So first of all, I cannot think of any reason why any applicant would choose no geographic preference. So if that truly is the question, like if you're planning on selecting no preference for the 3 geographical regions, I would strongly advise against that. It just makes more sense to choose them. Even if you don't have a personal preference, look at where your programs fall, the majority of them, and choose those regions, because you're going to increase your odds of getting interviews by doing so. If you do choose anyway to say no preference for the geographic regions, it's basically something along the lines of, I like everywhere and I'm happy to practice everywhere. It doesn't, for me, the location of where I'm going to train and practice doesn't matter. I just want to use my skills to help people. So, some version of that you can personalize based off of your life experience, based off your work experience. Perhaps I grew up in an area much like the East Coast of the US, but I have been living for the last 5 years in an area that's a lot more like the Midwest, something like that. So I'm familiar with different types of geographic regions, and I would be very comfortable and happy to train and practice in any region. So something of that nature.
She
For
did just clarify that she meant setting preference. So
Okay. Okay. It's actually a really similar response too. So for setting preference, when you're choosing no preference, you again have those 300 characters, and it's almost an identical response to what I just said, except for instead of saying like East Coast and Midwest, you would say, um, you know, I have done several clinical rotations in rural areas where I loved the welcoming culture. I'm also I also have experience working in a city environment, and I love the hustle and bustle of the busyness in urban areas. For that reason, I would be happy to train and practice in either setting. So a general approach to I like everything and I'd be happy everywhere, but insert some personal details to strengthen that response.
Perfect. So the next question is, if we have two impactful experiences, can we include one of the impactful experiences in the meaningful experience?
No, the meaningful experience should be exclusively dedicated to the experience that you tagged as meaningful. I can't think of a situation where it would make sense to write about like a hardship in a meaningful experience. I suppose there's always exceptions to everything, but I'm having a hard time envisioning how that would work well, but maybe that would be something for the person who's asking it. You like Zeph and I will share our contact information at the end. You can shoot us an email and give us like the details of exactly what you are considering doing, and we would be able to give you really good guidance based off of the details. I think that's a hard question to answer without the details.
Yeah, and I would just say, keep in mind that the meaningful experience is a reflection on part of your work history, your work research volunteer history. So the impactful experience is specific to a hardship. So that's more of like a life circumstance than it would be a CV experience. Um, and if you have two impactful experiences, I don't see any reason why you couldn't include both of them in the impactful experience section. For example, if you're a first generation college graduate and perhaps you had a parent die in your last year of medical school, like both of those things qualify as impactful experiences and hardships. And I don't see any reason why you shouldn't be able to mention both of them if you feel compelled to do so in that section. So the next question is, if someone is very active on leadership and or advocacy activities, could these go on the hobbies section? Um, yeah, start with that.
Um, yeah, I think so. It depends. So when you say if someone's very active in leadership and advocacy, if that is something that the person has been doing for a long time within established organizations, and it is something you genuinely consider like a hobby, like this is what I do with my free time. I like to be an advocate in my community. I think it is appropriate to include it as a hobby. It's a thin line to walk because what they don't want is people using the hobby section to share another experience, right? So if you're thinking of like bullet points or sliding in an extra leadership or advocacy experience, I wouldn't do that. But if it's genuinely a hobby and you can write about it in that context, then I do think it could be okay.
Yeah, and if you do have significant leadership and advocacy work, I would strongly recommend including that in your ERAS experiences. Generally speaking, even if you have to bundle those experiences into one experience box, essentially, it sounds like really meaningful work. And like Tiffany mentioned, the hobbies are more so for things that are outside medicine, outside professional um, activities. So ideally, it should probably fit in the CV experiences, but if it is really more of a passive activity, then it could be considered a hobby. Um, for medical graduates, is the time we take between the practice in our home country and being able to practice medicine in the US considered an interruption?
Can you read that again?
So for medical graduates, is the time we take between practice in our country and being able to practice medicine in the US considered an interruption according to the new uh, description of that specific question?
No, it wouldn't be. So the question is only pertaining to your medical education. So from the time that you start medical school up until you finish your degree or your internship, whatever the final capstone moment for your medical education is, um, if there was an extension within that, that's it. So if you graduate from medical school and then you take 6 months, 12 months, 18 months, 10 years to come to the US and apply, that's a gap outside of medical school after medical school. So you would tick no for that option.
Yeah, even if you take 2 years off to study for the USMLEs in the middle of your medical school, that's still not considered an academic or professional issue that caused the extension. If you want to discuss that, now you would discuss that in the personal statement, but it no longer belongs in the ERAS application.
Yeah.
All right. So is hometown something similar to geographical preferences, and does it only apply to US cities?
It's so I wouldn't say it's similar to the geographic preferences. It's just an additional component where the programs are able to learn a little bit more about you and where you've lived because at the beginning of the application, you're going to input your current address, your permanent address, and your mailing address. But that doesn't give a lot of insight into maybe the last 25 or more years of where you have lived, where you've grown up. So the hometowns is just a way for you to signify, hey, like I grew up in one, I was born in one place, but I moved to another place during my teenage years, and now I've been living in this area. So they can see a little bit more about where you've been, essentially. Does that answer the question?
Yeah, and they do not have to be US cities. The first input is the country for your hometown. Um, and again, you can think of it strategically, like Tiffany mentioned earlier. If you have lived in specific regions in the US that you know you're going to be applying to, you might want to consider adding one of those as a hometown and focusing your geographic preferences on those areas. So once we get into it, I'm going to be talking about correlation and confluence of all these factors, and that's one way you can correlate these different aspects of your application. All right, so I love this question. What would be a strategic way to choose the three meaningful experiences? US rotations and experiences back home or in other contexts, volunteering. So basically, what should we be considering when choosing the three meaningful experiences?
Yeah, that's a really great question. I think that diversity is nice within the three meaningful experiences. Some people choose to select all US rotations to kind of highlight, hey, I've had lots of experience here in the US. Right off the bat, the program's able to ascertain that this person has US hands-on clinical experience. Um, I think that's a good strategy, but I think a better one is to be diverse and perhaps highlight one US rotation, an important, meaningful volunteer experience that you had. And then if you have a research experience or a home country experience, something interesting. Last year I worked with someone who I was applying for general surgery, and she had done some volunteer work in India, which is her home country, in a leprosy hospital. And it was not relevant to general surgery at all, but it was very interesting. And it proved to be a point of conversation in almost every interview that she had. And, we chose to put that up in the meaningful experiences just because it's a standout, really kind of rare, interesting experience. So there's a lot of different approaches, but I'll just reiterate, I think that diversity and choosing definitely a US clinical experience if you have one to highlight that right off the bat. And then two that are different and help you look different from the 150,000 other applications that they're going to be looking at. Yeah.
Perfect. So this question we might need a little bit more context from, so feel free to email us. But the question is there a difference between being recognized with an Honor Society award versus a community category? I'm not sure if that question is clear enough to answer at the moment.
Yeah, let's go back because this is the section. So the question is there a difference between the honor society and the community? Because
Yeah, so there's different award types, and I guess maybe they're asking if it's significantly different, like if it's going to be viewed differently. But again, maybe just send us an email with your specific question, and we'll be able to address it more unique to your specific circumstances.
these, I should clarify too that these awards, they should be formal. They're not, there should be like a certificate or it's something formal that you were awarded by an organization or by your community, just to clarify that as well. Things like the Dean's List that qualifies, a research scholarship would qualify. But again, formal awards.
Right. Perfect. Well, I think we are ready to keep moving along then.
Okay, I do want to touch on one thing, Zeph, that you mentioned before I go into the personal statement, because I didn't talk about it. Within, I'm gonna take us back a couple slides because I think this is really important to this one. So Zeph mentioned something about bundling experiences, and I just want to explain what that is because it is an important way that you can get maybe a little bit more than just 10 single experiences into your application. So, and it's super challenging because of the 750 character limit, but if you have done something, let's say you have volunteered in a variety of one day or week long or weekend types of events, marathons where you were the doctor on standby, a community cleanup type of event, but you have like all these little volunteer experiences and you're really not going to have a lot of bullets to describe them because they were simple, they were just one day long. You can create what I would call like a volunteer box. So you would have within this section of your box where the bullets are, you would have a line that says, Crown Point City Marathon, doctor on call, community cleanup day in Cherville, whatever. You would list the individual items, maybe have one bullet point per item, as well as the date that experience took place on. And then in the top for organization here, you would put multiple or various, and you would then choose the date and the location of the very first experience that you're placing in the box. So you're taking a little bit of advantage of the space that you have to kind of to show like, hey, I did a lot of volunteer work, like from a period of 4 or 5 years. I've done all these individual items, and that can be really effective, especially if you're someone who has poured yourself in to doing a lot of different types of work to create a powerful CV. Only having 10 entries really can limit how well you can express that. So this is just a hack, if you will, that we very often use. We did this a lot last year and it was well received by programs. I did not have a single person come back and say that there was a complaint. People actually received compliments on their CV and the presentation of it. So I've also talked with AAMC, I've also talked with ERAS, and there's no rule against including more than one item within an experience box. Clarify that. Okay, so now we'll run forward back into the personal statements. Here we are. I want to start out by talking about personal statement myths. So these are items that you will see all over the internet. They're pervasive untruths about what your personal statement should do or has to do. The truth is, your personal statement does not have to do anything. It can do whatever you want it to do. It's a completely open space for you to decide how you want to present yourself. So first myth is that you have to start your personal statement with a really powerful hook to convince the program director to keep reading. That is not true. So the personal statement is not a document that stands in isolation outside of your application. The application as a whole is the book. Something about your application, whether it's your scores, a connection that you have within the program, a certain experience that you have, something already convinced them to read this book. The personal statement is just a chapter in it. It does not need to come out of the gate with some dramatic over-the-top hook that convinces people to read. That is just simply not the case. A first sentence or your first paragraph, the whole statement needs to be great. It needs to be really good and interesting and engaging as a whole. There is no emphasis on a hook. That's a creative writing strategy that somehow has made its way into personal statement discussions. Dramatic details and dialogue. This kind of goes along too with like the sad, sappy story. I saw a post on Reddit last year. It was like, however will I do my personal statement if nothing bad has ever happened to me? You don't have to have something incredibly sad or dramatic that you're including within the personal statement in order for it to be good. It's just your story, and telling your story well does not have to involve drama. Using a lot of dialogue, again, it's personal statements, they're not creative writing. There should not be multiple dialogue exchanges like we have characters within a story. That's not appropriate for what is professional writing, and that's what the personal statement really is. Having a theme to your personal statement. So an example of this could be, for instance, and this is a real example from someone who I spoke to, and this was their idea, that they wanted to basically compare their interest in internal medicine to a pizza. And they were going to talk about the components of internal medicine as the toppings of the pizza. And they were doing this because their family owned a pizzeria business, right? So it wasn't just a random idea, it was tied into their upbringing. But the idea that they wanted to do was to talk through all of their interests and the entire personal statement in a comparison to pizza. Anything that's overly themed like this. Another common example is sports, or something like mountain climbing, where every single paragraph ties back into a sport or to whatever activity you might think of. This is a very elementary approach to writing. It's not professional, it's not mature, and it's usually not cute or clever. It's usually just kind of cliche and maybe even annoying. So heavily themed personal statements are not a good thing. An indirect, a subtle theme of leadership, of advocacy, of compassion, these types of themes that are different strands of a theme that can pull all the way through are really, really great. But the really obvious direct themes are not something that you would want to do. There's a lot of advice that your personal statement should really highlight all of your experiences. If you have done a good job in your CV, they have already been highlighted. So there's no program director who wants to read through your CV and then read the narrative version of your CV in your personal statement. That's a waste of your space to repeat content in that way. And you're not likely to add too much to it if you're just going to focus on restating all of your CV experiences. I'm going to give you the next slide is going to be like things to do, and I'll talk a little bit more about how you can touch on your experiences within the personal statement without making it basically a second CV. What I want in a program. So this is something that online, there's a lot of advice to end your personal statement with, this is what I want in a program, or what I bring to the table. And I'll talk about what I want in a program first. So it's not really advisable to write about what you want in a program for two reasons. One is because you either have to do it in this really broad manner where you're not being too specific, because you can't really be very specific about what you want in a program since programs are so different. You run a high risk of wanting something that your reader doesn't have in their program. So it's just too difficult to write well in this section, because you're either being very, very broad, or if you are really, really narrow with what you want in a program, that should be because you're writing a customized personal statement to that particular program, and you know that they offer these things that you want. So the only time that you would talk about what you want in a program is if you're writing to a specific program. As far as what I bring to the table, your whole personal statement should be a dialogue of what you bring to the table, your whole application, your CV, your MSPE, your transcripts, everything, your letters of recommendation, everything is coming together to say, this is what this person brings to the table. There does not need to be a statement, a direct statement about, if I match with your program, I will bring these items to the table. I will bring these strengths into your program. Everything should work together to do that rather than making a direct statement. Okay, so switching kind of into the best practices, which are going to counter each of the points made on the previous slide. So your opening, as I mentioned, it does need to be good. It does need to be strong. And it usually works best to open your personal statement with personal details, right? It's a personal statement. So we're pulling in information that was not appropriate for the CV or any other application component. Now you get one chance to be personal, and I like to open by being personal. So this could be a detail about your childhood. It could be a life philosophy that you have. It could be sharing some type of hobby, maybe that you didn't have space to share about within the hobby section in the CV, but something that they could not learn about you from any other place in the application, personal, interesting, and I would say personable as well, meaning that it makes you a likable person, and it humanizes you. So the personal statement, especially that first paragraph, is your one opportunity to be a real person, not just a packet, an application packet, or an applicant falling in line with all the other applicants. You get to be a person. So take advantage of that first paragraph to connect with the program and share something personal and interesting. Why this specialty? That's something that absolutely should be addressed in your personal statement. It is somewhat about convincing the program that this is the one specialty for you and backing that up with why you're choosing it. This section can be really tricky when you're writing about why this specialty. I'll stick with internal medicine as an example. People choose their specialties because of what the specialty is and they like it. So often people cite similar reasons for choosing internal medicine: this broad scope of care, the opportunity for longitudinal relationships, the collaboration with other specialists, the lifelong learning component. That's what internal medicine is. And of course, that's why you chose it. It's because you like it. So you have to dig a little bit deeper. You have to go beyond the definition of the field and really, from your heart and soul, why this specialty, and talk about it in a way that's genuine, and is going to help you, again, stand out from other people, and again, humanize you, that you're a person, and that's why this specialty is meaningful to you. So when it comes to your strengths and your CV experiences, one of the big pushes out there is you have to show, don't tell. You have to show, don't tell, with the emphasis on don't tell. The truth is, in a piece of writing like this, where you have only one page and it is professional in nature, it's not creative. We're not going to be doing lots of descriptive setting descriptions and things like that. You want to show and tell. So you want to weave in your strengths by telling them. So maybe you want to highlight that you are a really strong communicator. And so you would tell within the personal statement, I am a very versatile communicator. This is a strength I gained while volunteering at the local YMCA. And then talk a little bit, one or two sentences about that experience. So we tell, and then we illustrate and show to support what we've told. You can also invert that, and you can describe an experience going beyond what you did on the CV, not just rewriting what you did on the CV, but going a little bit beyond it, more in depth. And then at the end of talking about that experience, you tell them what the strength or the takeaway you want them to have is. So showing and telling and blending those two things together, your strengths with your experiences, that's how you incorporate and highlight the experiences that you've had. It's all about blending things together. Your unique contributions that you can make to the program. So frankly, not everyone has super unique contributions that they can make to a program, and that's okay if you don't have them. But if you do, for instance, if you have a background in programming and you've been working on working on some like a phone app that's going to help patients with diabetes, something like that. If you have a background in mechanical engineering, or if you had a whole career prior to coming into medicine, you can talk about how that is really unique and how that's going to allow you to contribute to the program. Again, it's okay if you are the straightforward medical student who has just done medical school and you don't have like a quote unquote special talent. That's okay. But if you do, you definitely want to pull it in. When it comes to your closing, a really great strategy is to tie back into the opening. So go back to that really personal part of your personal statement way before you got into the specialty and all your strengths and everything. Remind them who you are as a person. Remind them of that interesting personal detail. You can even build on that personal detail in the conclusion. You can use the conclusion to draw conclusions. So it can be a reflective paragraph where you're saying new ideas that are pulling things together for the program director who's reading it. You can also include a call to action, which could be something like I would consider it a privilege to interview with your program this season. I would love to tell you more about A, B, and C during an interview. So you can do a call to action, basically leaving them with the concept of, oh, this person wants an interview. And of course you do, that's why you applied, but leaving them with that idea can be just a good way to prompt them like, yeah, you know what, let's meet this person. I do want to hear a little bit more about ABC. So what you should not do in a closing is repeat things from the personal statement or, just kind of do a generic couple of sentences just to work your way right out of it. You do want that closing to be meaningful. And that's why I think being reflective, tying into the opening can work really well. Last important point, despite the fact that you have something like 48,000 characters of actual space within ERAS for your personal statement, it should be one page. Programs do not have a lot of time to read past one page. People have matched with longer statements, that is true. But as a good rule of thumb, you should be able to tell your story in one page as it fits in ERAS, keeping in mind that you do not have control over font size or margins or any other formatting within your personal statement. So once you have your personal statement written, if it looks like it's on one page, copy it into ERAS and see if it actually is, because oftentimes you'll find it's a line or two too long as compared to what a Google Doc or Microsoft Word document will look like. So that's an important step to take, especially if you're pushing the envelope and it's getting close to application day. That's something you should check early. And I believe that wraps up my section of the presentation, talking about the CD, talking about the personal statement. Were there any personal statement questions, Zeph?
Yeah, so we have one personal statement question so far, and it's a great question. If I'm applying for general surgery, but as a step to reach a fellowship, how can I approach it?
If your end, that is a great, a really great question. If your end goal is fellowship, if you're going to want to have different versions of your personal statement for that. You're going to want to have a version that you're sending to programs that offer that fellowship, that particular path that you want to take. And within that version of your personal statement, it's totally fine to talk about that aspiration and why it's meaningful for you. Programs that do not offer any fellowships or a fellowship in the area that you're interested in, it's not the smartest thing to drop that in. It's definitely not smart to spend a lot of time talking about it, because those programs, well, really all programs, they're looking to hire a PGY1 general surgeon. They're not hiring a fellow. They're not looking at 3, 4, 5, 6 years down the line. They're looking at next season, right now, I'm building a cohort for PGY1 general surgery. So that is where the majority of your personal statement should focus in either case, but then you can have that version where you do spend some time talking about fellowship for those specific programs.
Wonderful. So we did have another question come up. Is there a specific structure of paragraphs suggested in the personal statement? Like 4 paragraphs suggested to say something, for example. So what's the paragraph structure, if there is one?
Yeah, so one thing you definitely don't want to do is do the 5-paragraph model. And the 5-paragraph model is one where the opening paragraph ends with like a thesis statement that highlights 3 key ideas, and then paragraphs 2, 3, and 4 talk about those 3 key ideas in order, and then the conclusion is a summary of the rest. So that approach is a definite no, because it's very elementary. It's not something that we would want to see in a professional advanced document like this. That being said, you can have 5 paragraphs. You could have 4, you could have 7. It really depends on how you're telling your story. And this gets, really into the kind of the nitty gritty of like writing technique, because you can have a paragraph that is one sentence in length. We use that as a writer, I would use that for impact, right? It would be like, it would be making a big statement to have a super short paragraph like that, and it would need to be an impactful sentence. So there is no rule or even best number of paragraphs to have. It's just about how you need to break, paragraphs break up your story. So it's about how you want to break up your story and what points you're going to make within those paragraphs.
Yeah, so some paragraphs might be longer, some might only be a few sentences. It's one of those things where, again, it's not a typical 5 paragraph thesis-based essay. It's more of a narrative, so
One
you
thing
can be
I'll
somewhat flexible with those.
one thing I'll add that's important is, just like we talked about with the CV, visual presentation absolutely matters. I think, and anyone who's here at this meeting can relate to this. If you open up a textbook and it is solid text, there's no images, there's no bolding, it's just like solid text. Nobody likes that. Like that makes you internally groan, like, oh, I don't want to read this. Like it looks like work. Um, the same absolutely is the case with a personal statement. So I would say at a very high level, when you're looking at your personal statement on paper, if it is like 4 huge chunky paragraphs, you want to change that. You want to find places where you can break that up. It is visually appealing to have paragraphs of different lengths, some that are shorter, some that are longer. And that just makes the document more inviting from a very instinctual place. When they first encounter your personal statement, it looks easy to read, and that can color, the way that they read it. So
Perfect. Should we expand in the PS on the experiences we talked about in the impactful experiences from the CV?
rarely, I would say occasionally there's a circumstance that warrants further explanation. But well, I said rarely, but within the actual instructions of ERAS, it says this section is for items that are not included in the personal statement or anywhere else in the application. So I have to take back my rarely answer and say no, because the instructions very specifically tell you not to write about the same thing in both places.
Yeah, so again, it comes back to letting each document serve its purpose to the fullest extent that you're able. Uh, yeah. All right. What about AI help? How do PDs or interviewers see these AI generated personal statements?
Um, I mean, nobody likes AI generated personal statements. I think that they are, by and large, extremely easy to identify. AI uses, for instance, the word tapestry. AI just like loves the word tapestry, and anyone who writes a lot or who reads a lot, as in a professional capacity, we know this. And program directors, because they've seen so many personal statements, the ones that are AI generated, they all feel the same. They all have similar vocabulary choices, a similar flow of the story. Um, so I recommend not using AI for generating your personal statement. AI can be a helpful brainstorming tool. You can, ask questions to AI and it can give you feedback. You can put your personal statement in, and just say, what do you think of this, AI? Don't ask it to fix it or to revise it. Just get that feedback from this third party person, and work with the feedback to make your own adjustments. AI is also completely unreliable in terms of detecting grammar mistakes. I correct it several times a day. Several times a day, it's like, that's not right. So use Grammarly. Like Grammarly is definitely a stronger grammar spell check type of system than ChatGPT, even the paid version. Yeah, I stay away from it outside of brainstorming.
Do you have suggestions about including preferences on specific tracks, for example, global health in the personal statement, or would it be better to keep it more general, especially in regards to programs that have those tracks?
Yeah, I mean, you can have multiple personal statements and assign specific ones to specific programs. And if you are really putting your all into your application, then you probably will have multiple versions of your personal statement. So for the global health track programs, you are going to emphasize that probably throughout the personal statement, certainly in the beginning and in the end. You're going to show how your experiences that show and tell, you're going to show how your experiences speak to the global health track. So yeah, it would be very advisable to have a customized personal statement for specific tracks. And then you've got your core personal statement, which is for everybody else.
Exactly. Specific to that specialty.
Yes, yes.
All right. I heard that it is not advisable to copy and paste directly from a Word document to ERAS for the personal statement. Is it advisable to write everything in there directly for the final personal statement?
No, I've never heard that before. Everyone I've worked with for years and years, I mean, quite literally like hundreds of people, I know for sure they're copying it directly from Word right into ERAS. You will sometimes need to get rid of some extra spacing that for some reason that when you put it into ERAS, it adds extra spaces between paragraphs. But you just backspace, get the spaces out, and yeah, you don't want to write it directly in the application in ERAS because there are no, like, it's not going to red underline if you misspell something. Yeah, it's not something I would do.
Yeah, so just basically copy and paste it and then make sure the formatting stayed how you intended it once you save it into the system. Perfect. Well, I think that is the last question for now for personal statements.
Okay. Yeah, all right, let's move on then. I'm gonna pass it over to Zeph, and I'm gonna turn my camera off while Zeph presents his section.
Steph, if you allow me for just 1 second, I wanted to say
Yes.
something prior. So please remember everybody who's a participant currently in the webinar that we are having some giveaways. So part of the giveaways, two of them will be, and please Steph, correct me if I'm wrong, it's going to be two CV companionship, or I don't know how it that you call it, preparation for the CV, and two for the personal statements, correct? So we're going to
Right.
Mhm. So we're going to have a total of four giveaways today. The way that we will do it is that within the participants, we're going to send a chat, a survey within the chat. So please, everybody who's interested in be a winner of this four giveaways, please put in, fill out the survey, and then you can now see how important the information that Tiffany and Seth have been sharing with us. So imagine doing this on your like a one-on-one and personal information. So I do feel that it's a very important, and thank you for those giveaways for you guys too as well. So okay, now Seth, you can continue with everything. Thank you.
Perfect. Yeah. So the giveaways are going to be two personal statements, holistic revisions. So working one-on-one to really optimize a personal statement that you've drafted already. And then the other is two giveaways for the CV development and revision process, where we're basically working with you step by step to help you get the content 100% ready for your ERAS application written sections. And in case you don't end up winning one of the giveaways, we are also offering a 10% discount for all services with the code MOLA10. So there's that available as well. But I definitely recommend that you fill out the survey and work with us through one of the giveaways. So for my section, I'm going to be diving into the strategy behind the application process. So ways that we can explore consistency, correlation, and confluence between all the application documents and how we actually go about applying to programs. So essentially what we're doing is we're trying to leverage the gamification of the residency application process as much as possible. So we want to understand how does each piece of the puzzle fit together to make the most cohesive and beautiful mural of essentially you, you as a person and you as a residency applicant. So we want to focus on the things that we have the most control over throughout the application process. So we spoke about the MyERAS application and the personal statements. There's also your ERAS photograph, which is, of course, extremely important. Your letters of recommendation and the MSPE, which is the medical school performance evaluation, with a special focus on the noteworthy characteristics. There's also letters of interest, which actually aren't necessarily a part of the formal application, but are definitely important for the application process. And then basically we want to figure out how all of these pieces are going to fit together for your program selection and signaling. So let's start off with some of the pieces of the application that we haven't gone over yet. So first off is your ERAS photograph. And as they say, picture speaks 1,000 words. So the ERAS photograph is incredibly important. Please go out of your way to take a professional headshot. It should be your head and shoulders. Attire should be very formal and tending towards conservatism. Don't go too far into the creative or flamboyant aspects of your wardrobes if possible. Just make sure it's business formal. And then, of course, you want to have an approachable and friendly demeanor in the photograph. If you can smile, I recommend it, even if it's just a pleasant uh, visage. Do what you can to make yourself seem amiable and personable. The next would be letters of recommendation. So you need ideally at least 2 letters of recommendation from the target specialty. So if you're applying to family medicine and internal medicine, you want at least 2 letters of recommendation that are recommending you for family medicine from FM experiences and 2 that are from internal medicine experiences. Now, not everybody can get 2 or 3 or 4 letters of recommendation from the specialty or specialties that they're applying for. So even if you have to reuse essentially what's the same letter of recommendation, just like the personal statement, try to have multiple versions of it. So in one version, let's say it's from an FM experience, they're recommending you for family medicine and really focusing on that throughout the entire letter. But they might also know that you're applying for internal medicine. So in a second version of the letter, they can acknowledge your pursuit of internal medicine and basically in the beginning and in the conclusion. And if they really want to go out of their way, they might even tie in a few sentences throughout the letter of recommendation that discusses how your experiences during that specific experience or rotation apply to the second field, which would be internal medicine. So just try to make sure that your letters of recommendation are going to be specialty specific. Don't apply to internal medicine with a letter of recommendation recommending you for pathology. That doesn't make any sense. And even a neutral letter of recommendation, it's okay to have neutral ones, but it's even better if you can have the multiple versions where they're acknowledging your pursuit of the specialty. And that way, every single one of your letters is consistent when it's being reviewed by programs. And please, 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 please get these done now. It's already mid-July. If you wait till mid-August to get your letters, you're going to be late and it's going to be September 25th and you might only have 2 letters of recommendation and it's a really not great position to be in. They take multiple weeks to get from your authors. They take multiple weeks to get uploaded and approved through ECFMG to be available in ERAS. So please get them done now. All right, so the medical school performance evaluation with a special note on the noteworthy characteristics. So sometimes applicants are requested to submit their noteworthy characteristics, which the medical school will then attach to the top of the MSPE. And so this is just another chance where you have sometimes control to express what you feel is important or noteworthy about yourself as a student and future position. So for the noteworthy characteristics, they're really short. According to the AAMC, they should be 2 sentences, and generally the guidance is about 40 to 60 words each. There's going to be 3 bullets essentially, and they should be written in third person. So they're being written about you. And again, those are going to be the first things that programs see when they're opening your medical school performance evaluation. All right, so letters of interest, I mentioned this before, it's not a formal piece of the application, but it's something that you might want to utilize throughout the application process and implement into your overall strategy. And so again, letters of interest, just like everything else, need to be customized and tailored to the target audience. So don't use the same letter of interest and just replace the program name for 20 different programs. We're going to get into it in terms of program research and signaling, but you really want to get into the nitty-gritty of the programs and really speak to what they have to offer that correlates with yourself as a candidate. So they're going to be highly personalized. You might consider sending some of these pre-application, for example, around mid-August, and then some of them potentially post-application if you don't hear back from programs. Typically about 3 to 4 weeks after applications go out, you might consider sending a either follow-up letter of interest or a first-time letter of interest to programs. And if you're trying to really get everything to come together and to correlate and be confluenced together, you might consider sending letters of interest to all the programs that you end up signaling. And we're going to be getting into what signaling is in a few slides here.
There's been a few questions that came in, so I'm gonna just go ahead and ask those now, or give them to you, Zeph, to answer. So first one is, if letters are not uploaded, how frequently should a follow-up email be sent?
I would say that right now, every 2 weeks is probably appropriate, but the sooner we get to the application period, you might want to do it every week. You don't want to bother people, and it can be a sensitive area. Um, but you do need the letters, and if they agreed to write them for you, then you do need to be following up. And if it seems like they're just becoming unresponsive, you need to know whether you're going to have that letter or not. So I would say just err on the side of caution by not bombarding them, but also do what you need to do to ensure that you're going to get that letter in time.
Yeah, I would add that a lot of times the writers don't understand that once we hit like September, really September 1st is definitely the second week of September. It can take weeks, literal 2 to 3 weeks to get that letter through the system. And if you don't have it when you apply, that can be a big problem for your application. So sometimes a gentle, when you do follow up, just a gentle reminder that, like, give them that deadline. Like, I would really love it if you could upload this no later than August 31st, just to ensure that it is part of my application. So I think sometimes giving them an idea of the time frame can be helpful as well.
Okay. Yeah, perfect.
So another question, should we get tailored letter of recommendation for transitional preliminary programs if we were applying for an advanced track?
Yeah, I mean that's a good question. I don't think it hurts to be clear about what the applicant's intentions are, especially if you're just applying to a transitional or preliminary track program, because essentially they're not hiring you for 3 years. So it's less important for them that, if you're going to be applying for an advanced specialty, doesn't necessarily need to be the same as your preliminary year. So you're going to have to figure out based on your specific circumstances how you want to frame those. But if you are truly applying to programs that are just PGY1, then you can be a little bit uh, lenient with how you frame each letter, if that makes sense.
Okay, there's another one. if we want to apply for family medicine and MI within the same university, even if it is not within the same city, can the university see that? I'm
So,
guessing family medicine and internal medicine within the same
right.
university. Okay.
Yeah, so basically, it is very possible that some of the staff co-serve from a family medicine residency program and the internal medicine residency program. So if there is uh, people working across specialties within the same hospital, it's possible they might recognize your application for both programs. So it's not to say you should never apply to the same programs at one hospital, but just be aware that it is possible they might know that you're applying to both specialties. So if they were to interview you for both, for example, you'd want to be really honest with them, like which one is your genuine focus specialty? Because if you tell both specialties that your primary choice is their specialty, they're going to probably know that you're lying for at least one of them. So don't do that.
IM and family medicine are probably the easiest to apply like to both of those specialties within the same university system or even within the same hospital because they are both primary care. And I think that you can be honest and also very convincing about really liking both of those fields. Like family medicine, I'll get to work with kids, and I'm fine with that. But I would also be fine not working with a younger population. So I think with those two specialties in particular, you're not you wouldn't find yourself in too much hot water. If you're going to apply for something like internal medicine and pathology, that's going to be trickier because you do still need to be honest and they're not similar specialties. So you just need to spend a lot of time planning prior to your interviews how you're going to answer if you're asked, how you will answer the question about why you applied to both and which one is your true area of interest. Okay, more questions. These are coming in. The latest date for an LOR to be submitted. That was the one that I was talking about, so I'll answer that. That ideally August 31st, but the actual last date, I mean, there is no actual cutoff date, but if you want that letter to be attached to your application so you can assign it to programs by opening day on 9/25, August 31st is a safe deadline. After that, I have seen them take 3 weeks to actually get posted into the application. And I think that there was one more. What documents are recommended to support an LOR request?
Yeah, so when you're getting ready to work with an author for your letter of recommendation, a lot of times they might specifically ask you for certain materials. So your CV, uh, sometimes they might even ask for a draft of your personal statements if you have one. And some authors even want like an outline of some of the things that you might want them to talk about. So maybe key characteristics that they could focus on. You might remind them of experiences you had during the rotation, especially if it was some time ago. They might not remember those things. So basically, your background information and then any supporting documents or background outlines that might help them with that letter of recommendation.
Actually, there
Yeah.
is the delay for the LOR to be uploaded to the application an ERAS delay or a submission delay? It's an ECFMG delay because they review manually every letter before they approve it to go into the application. And the volume gets so high starting in September that that manual review process just takes a long time. And actually, there was another one. If we are applying to OB and prelim surgery with the objective of reapplying to OB if you get prelim surgery, how would the LOR for surgery be focused?
Right. So again, if I'm understanding the question correctly, you're going to want two versions of the letter. So one, if you're applying for OB, it's going to be strictly OB. Now, for surgery, for your prelim programs, again, you can mention that you're going through preliminary surgery with the end goal of OB. And it's going to be up to you how much or if you want to focus on that for the letter. Some programs might prefer people who are strictly surgically focused, but I think it's generally okay to just be a little bit more transparent about what your goals are.
Yep. Let me just check. What about home country LORs? Will that actually work into my application? I have found some programs ask for 4 letters. I only have 2 or 3, but might add more from my home country, which is why I ask.
Yeah, so there's absolutely nothing wrong with having home country letters of recommendation, especially if you have US based LORs as well. So, and if you have significant experience in your home country, those letters can actually be vital to your application. So if you were a general practitioner for 5 years and you apply in the US and you have 2 US letters of recommendation, getting a letter of recommendation from your 5 year experience could actually be very beneficial for your application because it supports a significant aspect of who you are, what your skills and experiences are when it comes to incorporating those into the overall picture of your application.
And I'll add too, if a program is requesting 3 letters, you need to assign 3 letters to that program. If a program requests 4 letters, you need to assign 4 letters to that program. Programs can put filters in to filter out people who have incomplete LORs, meaning they wanted 4, you sent 3, they're going to filter you right out. I'm not saying every program does that, but it is a built-in filter within ERAS. It's not, it doesn't need to be customized like some others do. So take it very seriously. If they ask for 3, send 3. If they ask for 4, send 4. Applying with 2 could be very detrimental to the process for you. Another question. I'm a general surgeon and have a fellowship done. Foregut also, and then you think would be better to add those definitely. So I think the question is it okay to add a letter of recommendation from the fellowship and from the general surgery experience in the home country? And the answer would be yes, 100%. It would be totally fine to do that. And I believe that was all the LOR comments, but let me just double check. Okay. All right. So we'll move along.
All right, so now that we've talked about all of the application components for the most part, we're going to dive into program research and figuring out what programs to apply to and what programs that you might consider signaling. So generally speaking, you're going to want to be looking for about 100 to 150 of the most compatible programs for you based on the specialty you're applying for and also the credentials of your applicant profile. So it makes sense that you want to be applying to programs that you have a higher probability of getting interviews for. And one way to look for that is looking for programs with a history of interviewing and matching similar candidates. So let's dive into tools that you might use to figure out what the best programs are for you. So as Tiffany and I mentioned in the beginning of the presentation, we both worked with MyERAS for different periods of time. We're no longer affiliated with them, but we both still feel that they provide a very powerful tool to use when applying to residency. So what they offer are customized residency lists. And there are other lists out there, and there's no perfect list, but we really do feel that Match Resident has a lot of very valuable aspects to what they do provide. So they're customized lists, and they basically only show programs that you're compatible with based on your applicant's credentials when compared to the minimum requirements, which they ascertain from the programs directly, typically through phone calls and emails. And so they have a little rating system native to that program that are called compatibility scores. And essentially, it compares your credentials versus their requirements and also adds in factors like the ING friendliness and these various links, which are actually what I feel are the most helpful aspects. So they have interview link, match link, country link, and school link. And what that means is they're taking data from 20 plus years of candidates and the information that they're receiving from candidates about where they got interviews, where they matched, where their medical schools are from. Basically, they're inputting all that information to tell you which programs have interviewed candidates with similar profiles that have matched similar candidates to you. The country and school link show programs where they have interviewed or matched candidates that are either from your country or your school. So to me, I think that's really valuable information that can give you a better picture of what programs are looking for and who they're looking at for interviews and matching. Another really powerful feature of the customized list is the additional filters. So you can sort for various aspects of the application. So whether or not they require passing on the first attempt, whether their application deadline has passed, whether or not you need to be fully ECFMG certified at the time of application. Uh, you can also filter by geographic region, which is extremely helpful. You can filter by the state, and then you can also just choose to show the interview link or match link, country and school link programs. And as I mentioned, you can sort with the geographic preferences. So when you're looking at programs, and let's say your list starts out at 300 programs, you only are going to apply to 125. You start using these additional filters, the IMG friendliness, the interview link, the match link, to narrow your list. And another way to do that is correlating with your geographic preferences. So maybe you start out with 300 programs, then you shrink that down to 200 by just looking at your 3 geographic preferences, and then you continue to refine those through the additional filters. Another tool which is free is Residency Explorer. Now, Residency Explorer doesn't offer the customization and quite very many filtering features, but it is helpful. And what we recommend for especially our elite consulting clients is basically starting out with a customized list through Match a Resident. And that's sort of your foundation for program research. And then once you narrow your list, you start looking into additional information that's available. So going to Residency Explorer, pulling up the program, getting more information on the background of what they have to offer. So, for example, are they a university versus community program? What's the size and training environment? Are there additional opportunities that you might be interested in for those specific programs? And as you're going through these, you can actually keep notes either on an independent spreadsheet that you might create or keep track of your notes for each of these programs within Match a Resident. And you can save the programs in Match a Resident. You can mark them as applying, and then have your notes. So again, it's just, we feel a helpful tool. So another factor you might look at for Residency Explorer is demographics. Maybe that's an important consideration for you when deciding which programs to look at. And another tip, just in general, when you're looking for programs, is to actually look for newly accredited programs. And the reason we feel that this can be helpful is that sometimes newly accredited programs don't have set expectations for the exact types of candidates that they're looking for. And something you might even consider doing is reaching out to these new programs, calling the program coordinator and just having a conversation with the program coordinator and just getting to know them a little bit because there might not be very much information out there regarding their minimum requirements or what their training program is like, if they have specific training tracks that they're implementing. And what's really incredible is that you might find that after having a 5 to 10 minute conversation with the program coordinator, they are extremely excited by your interest in the program. They get your name. They're going to say they're going to look out for your application. Thanks so much for contacting us. And so without even trying, you essentially just created a really powerful strand in your residency network. And so newly accredited programs might be good to apply to, but also just consider reaching out to them and getting to know them. And you might find that you just got your foot in the door for a program or even several. Now, in addition to Match Residence and Residency Explorer, you can also look at program websites. Now, program websites are going to have more detailed information about their training tracks, specific uh, details about what they have to offer, uh, benefits, the surrounding area, what there's to do in the city, but more about the culture. Programs are going to be much more transparent through videos nowadays, especially since interviews are essentially all virtual. They want to put out more information about what their program is like. And of course, they're going to be kind of salesy and pitchy and say that everything's beautiful and great, but they are going to be providing more information. They're typically videos on the program websites that you might want to look at. And current residents could be a valuable page. Almost most program websites have current residents, and a lot of times you can tell whether those are international graduates or maybe you see a program and 50% of their candidates are from the same school as you. So you might make a special note of that program and say, wow, okay, like 50% of their candidates are from SGU and or from their current residents are from SGU. I'm going to really keep this program in mind for applying to and potentially even signaling since it seems like they're friendly to people from my school. I will caution you that when you're looking at program websites, if you're looking at them for the actual application requirements, it can be challenging because a lot of times program websites are not updated. And this is something that the actual program residency application requirements was the first thing I started doing back in 2009. And it's almost unbelievable how out of date these websites can be. Like some of them are still talking about the dean's letter, which has been the MSPE for years now, and they just haven't even updated that. Their website, and they're talking about uh, step scores and things that they haven't updated in years. So just take caution in terms of the minimum requirements. You can pay attention to the websites, but I would look for things more like how many letters of recommendation they require, which you can also find in Residency Explorer. And maybe some programs actually request you to address specific things in the personal statement. And if you don't address those specific requests, then you're going to be much less likely to be considered than all the candidates that took the time to go over the website, briefly look at the requirements, and notice, hey, they want you to ask or answer this specific question for the personal statement. All right, so we talked about applying to programs. So we start off with the whole pool of programs in your specific specialty. Then we narrow that list to programs that you're compatible with based on the minimum requirements. Then you narrow that even further based on, for example, geographic preferences, the IMG friendliness, and interview link, match link, school link, all these features that can help you focus on programs that are more likely to consider you as a candidate. So now we need to take that list down even further and talk about which programs you might consider signaling. So signaling was introduced recently. It's basically giving your application a special flag or signal. So when programs receive all the applications, they're also going to know who signaled it. So it's basically like a knock on the door for a certain amount of programs. And that varies within each specialty, and there's also multiple signal types within the different specialties. So you can see those in that table there. It's interesting. For example, internal medicine has 15 total, 3 are gold, 12 are silver, and family medicine only has 5. So the signaling considerations are going to be much different for family medicine versus internal medicine because with only 5, you have to be extremely precise about which programs you're signaling. Whereas if you have 15, you have a little bit more leniency about which programs and obviously how many signals you have at your disposal. So when you're considering which programs to signal, the first thing you're looking for is the programs that are the best fit for you and essentially are your top choices. And what that means is you want to be looking for programs that you have a strong chance of getting an interview with and that you're genuinely extremely interested in potentially getting hired by or matched with. So one thing to consider is you don't want to waste a signal. And essentially what that means is if you are almost guaranteed an interview somewhere, then you don't necessarily want to use a signal for that program. So if you have connections, you rotated with a certain hospital and they said, okay, definitely apply. We're going to look after your application. We're really interested in interviewing you. You don't necessarily need to also send them a signal, especially if you have very limited signals at your disposal. Um, Another on the opposite end of the spectrum is reach programs. So you don't want to use 50% of your signals on programs that you have almost no shot of getting into. So you have to be realistic about your credentials. Like, are your step scores strong enough to be signaling certain programs? Do you have enough research experience in your profile to be signaling high-level university research-based programs? So be realistic and try to find the best fits for you where you feel like that signal is going to make a meaningful difference in getting those interview invitations. Now, again, we want to think of this like narrowing the list. So we're starting broad and then narrowing it down. So when you're actually looking for programs to consider signaling, you want to be essentially utilizing all the things we've already looked at. So using the match resident list and the links and the filters to really narrow down the number of programs that seem highly compatible with you could be helpful. There's also filtering available through Residency Explorer that you can utilize for specific aspects. Now, you want to be very organized when you're looking for programs to signal. And what I'd recommend is from your list of 100 to 150 potential choices for programs, look for about 2 to 3 times the number of signals you have available to you for programs to consider. So if you have 5 signals available, basically you're looking for about 10 to 15 programs to choose from. And I definitely recommend keeping like a spreadsheet for the signaling research process. So obviously you want to have identifying information, which would be the ACGME code, program name, whether or not they participate in the signaling itself. Not all programs do. So obviously you want to pay attention to that. And then within Residency Explorer, there is graphical information about how strongly considered signals are for each individual program. So essentially, what percentage of interviewees also signaled the program. And you'll notice that sometimes it's a very high impact for programs, and sometimes it's lower impact. So you can factor that into your decision making. Of course, typically you want to be compatible with the program's minimum requirements. If you feel especially called to go out of your way to apply to a program and signal a program that you feel you don't meet their minimum requirements, that's up to your discretion, but generally speaking, you want to be compatible with the program itself. And keep in mind, programs do update their minimum requirements throughout the application cycle. And a lot of times they don't update those until mid-July, typically at the earliest. And then sometimes it's not even until later in August, even September, that they have actually updated their minimum requirements. For a lot of people, IMG friendliness is a very important consideration. So having a proven track record of working with IMGs in the past, but having current IMGs is very important. And if they don't have any international graduates or they don't even consider them, then obviously that's something that you would want to pay special attention to. And then the various link features that we talked about that are in the customized list, match residents, and again, correlating everything together. So are your signal programs also referenced by your geographic preferences? So if your geographic preferences also align with your signals, that is adding further confluence to your application as a whole. And is it a community versus a university program? Are you going to be focusing mostly on one or the other? Do you have a preference? Are your application materials more suited for a community versus a university hospital setting? And then I would just recommend keeping track of basically what I consider customizable factors that are pertinent to you. So, are there educational or research opportunities, for example, in the Residency Explorer uh, tables that are important to you, or something that you're looking for in terms of special training tracks from program websites? Are there demographic factors that you want to consider when looking at signaled programs? And then you might even consider something like the doximity ratings for the specific programs. Like, do people actually like this program? What do they think of training here? And then maybe you use the overall score that's found in Match Resonance or the interview feedback. So basically, you want to use the very concrete filters to find the programs and then go into more of the subjective aspects of the program to further basically take that list of 15 to 20 programs down to the 5 or 10 or 15, however many signals you have at your disposal. So again, it all comes back to putting all the pieces of the puzzle together through consistency, correlation, and confluence. So we talked about the application components and program signals and selection. So for the MyERAS application, what does your CV look like? What are your strengths? What sorts of programs are going to be most interested in your application? Do your geographic settings and your geographic preferences and setting preferences correlate with the programs that you're not only applying to, but also signaling? Um, what about your meaningful experiences? If you're applying to only family medicine, then ideally at least one or two of those meaningful experiences, those first things they're going to see, are related to that specialty. And if you're applying to multiple specialties, you're not necessarily highlighting very specialty specific experiences in those meaningful experiences as not to turn away programs from different specialties to your application. And again, we talked about hometown selection also correlating with your geographic preferences. Now, your personal statements, if you're really trying to go above and beyond, what Tiffany and I do with our consulting clients is we actually work through customized versions of the statements for every program that they're going to be signaling. And not only that, but we're also going to be sending letters of interest to those programs. So you have the whole background of your application correlating, and then you have these customized statements and letters of interest and the signal for these programs. So they're going to see all these factors lining up, and it's going to really help you stand out for a select group of programs within the broad spectrum of programs that you apply to. So as I mentioned, the letters of interest, you might have sent a few in August, and if you don't hear back from programs, you might send follow-ups about a month after applications go out. All right, so for the timeline, it looks like our little image isn't coming up, but basically, there's a few key important dates. The one that's going to be coming up is September 4th, where you can start certifying your application and submitting it to programs. Don't certify and submit your application on September 4th. There's absolutely no reason to do that. Uh, Once you certify your application, it is completely locked in for the duration of the season. The only thing you can change is your personal information. So your CV is completely locked in for the entire cycle. So don't aim to certify your application super early on September 4th or 5th. Just give it time take the extra time to really make sure that your application is 100% ready before certifying. Aim for maybe the September 15th or the 20th, uh, but don't do it right away and then realize you missed something or you messed something up. So applications are released on September 25th this year, and things to keep in mind is, like we've been reiterating multiple times, please get your letters of recommendation done early so that you can apply with 3 or with 4 letters of recommendation, whatever the program requires, on September 25th. Apply with a complete application so that you don't have to worry about it. Uh, some people might be wondering whether or not they need to be fully ECFMG certified at the time of applying. And this is actually a really great question. It causes a lot of confusion for applicants and for programs, even for program coordinators. Sometimes they don't even understand their own requirements. Uh, but basically, some programs do require that you be ECFMG certified at the time of applying. So if you're not ECFMG certified, let's say you're still in medical school, you can't be ECFMG certified until you graduate. You shouldn't apply to those programs that specifically require it on September 25th. That is one of those additional filters that's extremely helpful. You can use through Master Resident. Just don't apply to those programs. And then if you do get certified for whatever reason in time to apply before their application deadline, then you might consider applying to those programs. But typically speaking, really IMG friendly programs aren't going to require you to be fully ECFMG certified at the time of application because they know that MS4s aren't going to be certified. So those would be the key dates I would say to keep in mind that are coming up. Again, aim to have your LORs done by August 31st, completely uploaded so that they're ready to go by the 25th. And that pretty much covers it. I know we're going to hop into some more Q&As here, but I just wanted to remind everybody to fill out that form for the giveaways. We're doing 2 personal statements revisions and 2 holistic revisions and developments for the CV. And for everybody else, and we are offering 10% off all our services with the code MOLA10 on Class Act ERAS Consulting. Just a little side notes, rush prices are starting soon, so just wanted to throw that out there. But yeah, let's dive into some more questions if we're ready, Tiffany.
All right, there are a couple that have popped up, so I will read those. This is a CV question. If we have performed one job not related to medicine, is it a good thing putting that in the CV? I'm not sure, but I've heard from different people it's a good thing, and I would love your opinion on this. Um, my opinion is yes, it can be really awesome to include something that's not medically related on your CV. It can demonstrate, a more diverse set of skills or professionalism with depending on what the experience is. And sometimes I will have people who have worked what they would consider maybe very menial jobs. They've worked like in the food and restaurant industry, something like that. But that was like while they were in college or while they were in medical school. And that just shows, time management, persistence, your ability and your commitment to the path, even if you had to support yourself. So I would say most of the time it can be a very good thing to put a non-medical job in your CV. Okay. The winners, oh, okay. The winners will be announced at the end. As far as the urology match goes, that is actually not something that Zeph or I are really well versed in. It's like the ophthalmology match. It's different than everything that we've talked about. The timeline is a little bit different. What programs ask for is a little bit different. And unfortunately, it's just not something that we have encountered a great deal. So we could not say that we are super familiar with it. Is there a way to know if program sees signals?
So programs are going to know everyone that signaled them. And whether or not they look at your application because of your signal, I don't think there's any way to know unless you get an interview invitation, if that's what you're asking specifically.
That's my understanding as well. Yeah, we don't, you don't know if a program decided to review your application or not, regardless of if you sent a signal. Okay, there's a couple more that have come in. In what circumstances would you suggest to a candidate to go for the next cycle, like not having step 2 scores in time for September deadline, having only 2 LORs? Yes, both of those. Applying without a step 2 score, I wouldn't say that would make it impossible to match, but ever since they made step 1 pass fail, step 2, it just became the new metric, one of the big filters that they use. And not having it done, it can be scary for a program, risky, because what if you take it and you get an attempt and then it's going to be several more months, right? So they want to look at candidates who have locked in some of the actual requirements. And same thing with only 2 LORs. Programs ask for 3, they want 3. It shows that you follow instructions. It shows that you had, that you had the ability to ask more than 2 people. Like it just reflects well on your character and your capabilities. So those are 2 probably of the strongest reasons that I would advise someone to wait a year. The same could be true if you have no clinical experience, not like very little in the home country, very little in the US. Everything has been like a virtual or a tele-rotation. I would say that it would make sense to take the time to build up your application to some extent. And the same for those targeting research programs. If you really, really want to go to a research university level type of program, yeah, do a research year. Like you're not going to get in to a program like that with just 2 case reports published. You would need to have a substantial CV to support that type of application.
Yeah, I would just add that the application process it's rigorous, it's expensive, uh, it's emotionally taxing potentially. So you really need to figure out what you want to give and what you're trying to get. And if it comes to having an application that's 2/3 done this year, or that's 100% awesome next year, just wait, save the time, save the money, save your emotional effort, get all the pieces that we've been talking about to really come together so that it's seamless and just as strong as it possibly could be. Now, if you have everything together and your step 2 score might come in a couple weeks after September 25th, okay, you might consider applying once you get that step 2 score. You might, you're gonna obviously re-release your USMLE transcripts. You might send a couple programs just a little update, and maybe even by the time they review your application, your step 2 is in there. But if you're missing step 2, you only have 2 letters of recommendation, you're missing US clinical experiences, like there's no sense in spending the $2,000 to $5,000 minimum to apply just to be disheartened by not getting interviews or not getting matched. So, I would say just make sure that you're at a place where everything has come together and that you're able to really give it your all as a general principle.
Yeah, I want to add to that too. Don't ever rush step 2 to be able to have your score in time to apply. I have worked with people who have done that and ended up with an attempt, and an attempt lasts forever, right? Whether if you're going to hold off for 1 year, that's 1 year. An attempt it's going to follow you, and it is absolutely going to affect your application season and probably where you match as well. So it is worth it to take your time with that. On that same note, very important, the USMLE came out with an announcement in March that the scoring turnaround time now is going to be 4 weeks. It historically has been 2 weeks up until, much like the LORs, up until September, and then sometimes it would take longer than the 2 weeks. Now they're saying 4 weeks, and I'm seeing in the IMG sub in Reddit that it is in fact taking these 4 weeks and even 5 weeks to get the score back. The USMLE also said it could take up to 8 weeks. So that's just something to be aware of. Taking step 2 on September 1st is not likely to get you your score and time to apply. As I noted, you don't want to rush. It's not worth an attempt to cut your study time and rush into it. If you end up in a position where you don't have your score, or you don't have that 3rd or 4th letter of recommendation, using the match resident filter for the program application deadline, whether or not it has passed, is really, really crucial. Some programs, the deadline is September 25th. And if you don't have what you need on September 25th, then you don't want to apply to those programs. But there are an increasing, like an ever growing amount of programs that have application deadlines in October, November, December, or no deadline. It's like just a rolling application process. Those are the ones that you'd want to focus on. Wait until you have your score, wait until you have those letters, and then send your application. That's a much stronger approach than sending an incomplete application and re-releasing the transcript. Like you can do that, but a really good approach would be identify programs with later dates and apply when your application is complete. And we had a couple more, or at least one more question. What about research experience? We all know research takes a lot and it's sometimes about patience. What if we are working in a lot of projects, but nothing gets published before September? What should I put in my application without any project finished or published? Yeah, you can use one of your experience boxes. Research is an experience type category that you can select. And within that box, you can, outline what your specific responsibilities have been, how you've contributed to the research, and even give some information about, anticipated, or we anticipate submitting for publication on October 1st, something like that. So there's ways that you can express your involvement with research outside the publication section. That being said, if you're looking at like a research heavy type of program, that's not going to be enough. You will need to have a healthy publication section to be considered probably by most of those programs. So it just depends on what you're targeting.
Yeah, and there also is an other than published journals and articles section in the publications. So for those things that are at various stages of the publication process but aren't published yet, you may be able to add those there.
Yeah, if it's been submitted, if it's in revision stage, and there's I think 3 or 4 total options for other than published. So if you can get it a little bit through the pipeline, at least submitted, then it is something that you can include in that section as well. And that was our last question. Unless any more come through here, I think we're ready to wrap up.
Thank you.
Perfect. Well, yeah, I just wanted to throw one more thank you out there to Mola and Janeth, and everybody who has been here today. The questions have been absolutely fantastic. One little side note, it's not publicly available, but I do have one consulting seat left available for anybody who might be interested. Please feel free to reach out. For those people that had questions that we weren't able to address specifically because we didn't know the background circumstances, feel free to email us. You can go to the website and contact us, or just email at supports@classacterasconsulting.com. And yeah, it's just been a wonderful presentation. And thank you, Tiffany and Janeth, and everybody who's been here.